mynews.studio.
In a single year, 1 million more children received full vaccinations. But even with that progress, millions are still being left behind. Why is that happening?
Today is July 31st, 2025. The newest data from WHO and UNICEF shows that for the first time since the pandemic, childhood vaccination rates are rising again. Last year, 89% of infants worldwide, about 115 million, received at least one dose of the DTP vaccine. That's diphtheria, tetanus, and pertussis. Out of those, 85%, or roughly 109 million, completed all 3 doses. That's an increase of 1 million children finishing the series compared to the previous year.
Right, and we're seeing this rebound after years of setbacks from COVID-19. What's driving the recovery? It looks like renewed international collaboration and some targeted outreach programs. There's been a real push to reach what they call zero-dose children, those who haven't had any vaccines at all. In practice, that's meant mobile vaccination teams going to remote or conflict-affected areas. They've also connected immunization with other health services, and local health workers, people whom communities already trust, have been central.
And community leaders too. They've played a big part, mobilizing families, addressing myths, making sure kids come back for follow-up doses. But the situation isn't the same everywhere. Nearly 20 million infants still missed at least one DTP dose in 2024. Of those, about 14.3 million are zero-dose children. That's still above pre-pandemic levels. So we're not yet meeting global health targets. Why are these numbers still so high?
Most unvaccinated children live in low- and middle-income countries, especially in Africa and Southeast Asia. Actually, just 10 countries, like Nigeria, India, and the Democratic Republic of the Congo, account for more than half of all zero-dose kids. The main barriers? Conflict, humanitarian crises, and misinformation.
In conflict-affected countries, it's especially stark. A quarter of the world's infants live in just 26 nations, but those same places account for half of all unvaccinated children globally. That's a huge concentration of risk. And it's not just about access. Vaccine hesitancy is an issue too, fueled by misinformation on social media and declining trust in institutions. We've seen that even in high-income countries.
So, how have health workers responded? They've used proactive risk communication, involved trusted community figures, and run targeted campaigns. The key has been to respond to local concerns directly, not just use generic messages.
Despite all these difficulties, this recovery in vaccination rates is expected to prevent thousands of deaths from diseases like measles and polio. It's more than just numbers. It shows that health systems can adapt and recover if they have the right support.
The countries that made real progress had resilient primary health care, flexible delivery models, and strong partnerships at the local level. The takeaway? Sustained investment and targeted strategies are essential, especially for the most vulnerable children.
But the job isn't finished. Yes, the rebound is a milestone, but there are still deep inequities. I wonder, can these lessons be applied to other public health challenges?
That's the key question. This year's rebound is a sign of renewed trust in public health and international cooperation. But closing the gap for every child is still a test of global solidarity and adaptability.
So, to sum it up, global childhood vaccination rates are up for the first time since COVID-19, thanks to targeted outreach and collaboration. But millions of children, especially in conflict zones, are still not being reached.
And closing those gaps will take ongoing commitment and adapting strategies to local contexts. Thanks for joining us.
Thank you for listening. This episode was powered by mynews.studio. Try it now for free.